You wake up one morning with a dull, persistent ache in your jaw. Or maybe one of your back teeth starts throbbing for no obvious reason. Your first instinct is to call a dentist. That seems logical. But what if the real problem isn't in your mouth at all? What if your heart is trying to send you a message, and your jaw just happens to be the phone it's calling? This is not a rare quirk of medicine. It's a real, documented phenomenon that carries life or death stakes. In 2025, a medical journal published a case that illustrates this perfectly. A 76-year-old woman had persistent pain around her lower gums. Her dentist found nothing wrong. 2 teeth were extracted. A denture was fitted. The pain only got worse. She was eventually diagnosed with atypical toothache and prescribed antidepressants. Months went by. The pain began flaring up specifically when she walked or climbed stairs, and calming down when she rested. When advanced cardiac imaging was finally performed, doctors found 90 to 99% blockage in 2 major coronary arteries, plus a blood clot in her heart. After cardiac surgery, her toothache vanished completely. The cause of her tooth pain was never her teeth. It was chronic, progressive heart disease. How does heart pain end up in your jaw? The answer lies in how your nervous system is wired. When the heart muscle is deprived of oxygen, it sends distress signals through cardiac nerve fibers. These signals travel up through the vagus nerve and sympathetic pathways until they converge with the trigeminal nerve system, which is the nerve network responsible for sensation in your jaw, teeth, and face, at a junction point in the upper spinal cord, around the C2 level. At this crossroads, the brain receives overlapping signals from both your heart and your jaw region. Because the brain is more accustomed to processing signals from the face and teeth than from the heart, it misidentifies the source. It interprets cardiac distress as tooth pain. This is called referred pain, and it happens because 2 different body regions share the same neural highway. The numbers here are more significant than most people realize. Research shows that roughly 40% of people experiencing cardiac ischemia feel some form of pain in the jaw, throat, or face. More strikingly, studies report that approximately 4% of heart attack patients present with jaw or oral pain as their only symptom, with no chest pain at all. And between 8 and 30% of all heart attack cases involve no typical chest pain whatsoever. Patients who have these atypical presentations face a death risk up to 3 times higher than those with classic chest pain, because the unusual symptoms lead to delays in diagnosis and treatment. So how do you tell the difference between ordinary tooth pain and cardiac referred pain? The distinctions are real and learnable. Dental pain has a local source. Press on the tooth, and it hurts right there. Cold water or tapping triggers a sharp, specific response. An X-ray or examination usually reveals a cavity, an abscess, or gum damage. Dental anesthesia eliminates the pain. Dental treatment improves the situation. Cardiac referred pain behaves differently. The most important clue is the pattern of exertion and rest. The pain comes on when you climb stairs, walk briskly, or experience emotional stress, and it fades within 5 to 10 minutes of sitting still. There is no specific tooth that hurts more when you press it. No dental finding explains the pain. Dental treatments provide no relief. And if a nitroglycerin tablet placed under the tongue makes the pain disappear within 1 to 2 minutes, that is a strong indicator of a cardiac origin. This issue carries particular urgency for women. The image of a heart attack as crushing chest pain in a middle-aged man is deeply misleading. Women experiencing heart attacks are far more likely to report jaw pain, throat tightness, extreme fatigue, nausea, indigestion-like discomfort, and shortness of breath, rather than classic chest pressure. Research shows that a substantial portion of early warning signs in women having heart attacks are missed or misinterpreted. This contributes to the fact that in some countries, women have higher heart attack mortality rates than men. The atypical symptoms lead to delays that cost lives. The urgency of getting this right cannot be overstated. A heart attack is a time-critical emergency. In the most severe form, the window for effective reopening of a blocked artery is ideally within 2 hours of symptom onset, and hospital protocols call for restoring blood flow within 90 minutes of arrival. Beyond 12 hours, the damage becomes increasingly irreversible. Beyond 24 hours, recovery is extremely difficult. Every minute of delay means more heart muscle lost permanently. This is why a misread symptom, treating cardiac jaw pain as a dental problem, can be fatal. The woman in the 2025 case report spent nearly 2 years having dental procedures before her heart condition was identified. Her arteries were nearly completely blocked throughout that entire time. There are certain warning combinations that should prompt immediate emergency response. Jaw or tooth pain that worsens with physical activity and improves with rest is a red flag. Pain that does not respond to any dental treatment is a red flag. Jaw pain occurring alongside shortness of breath, extreme fatigue, nausea, sweating, or any chest discomfort is an emergency. Anyone with known cardiovascular risk factors, such as high blood pressure, diabetes, smoking, obesity, or high cholesterol, who experiences unexplained jaw or tooth pain, should treat it as a potential cardiac warning. If you or someone around you experiences sudden, unexplained jaw or tooth pain, together with any of those accompanying symptoms, do not drive to the dentist. Call emergency services immediately. Your heart does not always speak in the language you expect. Sometimes it speaks through your jaw. Knowing the difference between a dental problem and a cardiac warning signal could be one of the most important pieces of health knowledge you ever carry with you.